How to treat and cure tennis elbow. Tennis elbow is a condition caused by inflammation of the tendons on the outer bony prominence, lateral epicondyle, of the elbow. Certain repetitive movements of the wrist can cause this condition. Tennis elbow can occur in anyone who strains the tendons of the forearm and is not limited to tennis players. Tennis elbow causes any repetitive motion of the wrist, including tennis, hedge clipping, excessive use of a hammer or a screwdriver, painting, or any activity that requires excessive constant gripping or squeezing can cause tennis elbow. In the game of tennis, the following maneuvers can lead to tennis elbow. One-handed backhand with poor form. A late forehand swing resulting in bending the wrist significantly. Snapping and turning the wrist while serving with full power. Tennis elbow symptoms and signs. Tenderness on the outer bony part of the elbow. Morning stiffness of the elbow with persistent aching. Soreness in the forearm. Pain worse when grasping or holding an object. Diagnosis of tennis elbow. Your doctor may use any or all of the following to diagnose tennis elbow. In taking your medical history, the doctor may ask you questions about your activity level, occupation, recent recreational activities, medications, and other medical problems. During the physical exam, your doctor will feel your elbow and possibly other joints. Your nerves, muscles, bones, and skin are also examined. X-ray images may be required if the symptoms suggest another problem in the elbow joint. Nerve studies may be needed to look for entrapment of the radial nerve in the elbow joint, radial tunnel syndrome, if your symptoms continue despite aggressive treatment. It is unlikely your doctor will need to perform blood tests, a CT scan, or an MRI to make the diagnosis, but these may be used to rule out other conditions in certain cases. Tennis elbow home remedies. Home remedies include icing the area for 20 minutes twice a day to help to decrease inflammation and relieve pain. Freezing water in a paper cup and tearing away the top rim as the ice melts is an easy way to use ice. Do not put ice directly on the skin. Wrap it in a towel. Rest the sore area to prevent further injury and decrease pain. Over-the-counter anti-inflammatory medications such as ibuprofen, Advil, Motrin, aspirin, or naproxen, Aleve, may help decrease the pain and help the healing. Tennis elbow treatment. Home care with ice, rest, and over-the-counter anti-inflammatory medications are the mainstays of treatment. If these do not produce the desired result, the physician may choose to begin a second line of therapy. An elbow strap or splint may help take the pressure off the inflamed tendon. Physical therapy involves different exercises to increase flexibility and strength. These exercises are usually performed at home. Medications for tennis elbow. Steroid injections can be made into the inflamed area. Although steroid injections are safe, they are usually limited to 2 to 3 times a year. Having steroid injections more frequently than that will weaken the tendon and make it more likely to rupture. If positive results are not seen with the first injection, additional injections are also unlikely to work. A newer treatment involves injecting several milliliters of the patient's own blood into the inflamed tendon area. This is referred to as autologous blood injection. This has been reported to help heal the inflamed tendon faster, and its effectiveness is still being investigated. Surgery for tennis elbow. Surgery is usually a last resort but is successful in relieving pain in most people. The operation for tennis elbow involves a small incision over the elbow to trim the tendon or sometimes to release and then reattach the tendon to the bone. It can usually be performed as an outpatient procedure taking several hours. Candidates for surgery are usually those who have had symptoms for more than 6 to 12 months despite non-surgical therapies. Several months of rehabilitation at home and working with a physical therapist are required and begin about 6 weeks after surgery. As with any surgery, there are risks, which you should talk about with your doctor. Tennis elbow follow-up. Continue the treatment plan for the prescribed length of time. Ending a treatment plan too early increases the chance of re-injury to the tendon. If, after a period of relief, your pain comes back, return to a treatment plan or revisit your doctor. Prevention of tennis elbow. Adjust racket size. Use a mid-sized racket. Oversized rackets can put too much strain on the arm and increase the risk of injury. Loosen string tension. Higher string tension can increase the torque and vibration the arm experiences, thereby increasing the risk of injury. Adjust grip size. A grip too small or too large decreases your control of the racket and increases your risk of injury. Check racket material. Graphite rackets and nylon strings seem to decrease the torque and vibration the arm receives, thus reducing the risk of injury. Use a tennis elbow strap or tennis elbow brace during play until completely healed. Be careful not to extend the wrist when hitting a backhand. Take a lesson from a tennis professional and explain your difficulties and symptoms. Prognosis of tennis elbow. A vast majority of people have pain relief within 12 months of conservative therapy, ice, rest, and anti-inflammatory medications. Those who do not get relief with conservative therapy go on to other treatments, also with very high effectiveness. Failure to follow through on a therapy plan frequently leads to recurrence. Treated. You can start treating tennis elbow at home right away. Rest your arm, and avoid any activity that makes the pain worse. As soon as you notice pain, use ice or cold packs for 10 to 15 minutes at a time, several times a day. Always put a thin cloth between the ice and your skin. Keep using ice as long as it relieves pain. Or use a warm, moist cloth or take hot baths if they feel good. Do what works for you. Take over-the-counter pain relievers such as ibuprofen or naproxen, NSAIDs, or acetaminophen if you need them. Or try NSAID cream that you rub over the sore area. Be safe with medicines. Read and follow all instructions on the label. Wear a counterforce brace when you need to grasp or twist something. This is a strap around your forearm worn around your forearm just below the elbow. It may ease the pressure on the tendon and spread force throughout your arm. After the pain eases, your doctor or physical therapist can teach you rehabilitation, rehab, exercises to stretch and strengthen your tendon. Doing these exercises at home can help your tendon heal and can prevent further injury. When you feel better, you can return to your activity, but take it easy for a while. Don't start at the same level as before your injury. Build back to your previous level slowly, and stop if it hurts. To avoid damaging your tendon again. Take lessons or ask a trainer or pro to check the way you are doing your activity. If the way you use a tool is the problem, try switching hands or changing your grip. Make sure you are using the right equipment for your size and strength. Always take time to warm up before and stretch after you exercise. After the activity, apply ice to prevent pain and swelling. Be patient, and stay with your treatment. You will probably feel better in a few weeks, but it may take 6 to 12 months for the tendon to heal. In some cases, the pain lasts for 2 years or longer. If your symptoms don't improve after 6 to 8 weeks of home treatment, your doctor may suggest a shot of corticosteroid. This could give you some short-term relief so you can start rehab exercises. Surgery is seldom needed for tennis elbow.